phones, and they see the market just exploding for those types of solutions, and people will pay in that area.
We obviously look at the world globally, and we see many business models, certainly consumer pay being a strong one. We've got an example of a U.S. consumer pay product. This is for Alzheimer's patients for tracking, and this is obviously where there's concerned family members or institutions that are housing Alzheimer's patients that want to be able to geofence the patients and know when they've kind of wandered off beyond and be able to locate them afterwards. Definitely entirely a consumer pay product at this point in the marketplace, sponsored by the Alzheimer's Association. But there's other models, and many of you, I'm sure, are familiar with the Kindle. And the Kindle model is a cell phone. It wasn't originally well known that it was a cell phone. They kind of tried to hide it under the label WhisperNet, which was a completely made-up name for their network, but it was really, at that time, Sprint. And as you know, you don't pay as a user for that network access. Effectively, what Amazon has done is sold you a bookstore. They've called it an e-reader, but they really sold you a bookstore. And then you actually go to your own bookstore and buy your own books. And just like when you go to the bookstore, they don't charge you for shipping and transportation. Same thing happens on the Kindle, and that's happening with other e-readers. So we're seeing examples where the manufacturer is saying, I've got a disposable or a consumable involved here. And I have a financial interest in making sure that the consumer keeps buying my product. And so I'm going to pay the connectivity. I, the manufacturer, can pay the connectivity. And so we're going to see some examples where, for example, I call it putting the reorder button on the razor blade handle. If you think about it, there's a whole bunch of things in healthcare where you have to buy the same thing over and over and over again. It could be pills. It could be a consumable supply. It could be a disposable supply, which is the same thing over and over again. And there's lots of opportunities, essentially, to put the reorder button on the device. And so I think you're going to start seeing some examples where the manufacturer would like to kind of marry you to the device. But that may extend beyond. This isn't a phenomenon related just to healthcare. It may be on the coffee machine. Think about it. It would be as simple as, I need some more. You push the button. FedEx brings it to you tomorrow.
This is a healthcare panel, Don. Let's stop talking about coffee.
Every good day starts out with a cup of coffee, at least for me.
Ken, any further thoughts on who pays?
Oh, you know I always have thoughts. No, actually, I'm going to take just the opposite approach with this. I mean, I already said earlier that I don't see, at least for our devices, and there's several different types of devices out there, at least for our devices, that consumers are not ready yet to purchase this in mass. There's not a carrot and stick approach out there for it. There's no incentive for them to go through and do it. Of course, I'm going to purchase it for my mom to make sure that she can stay in her home longer instead of going into an assisted living. And I'm going to purchase it for my child because they have diabetes and there's no nurse in school and I can't concentrate until I know that they're doing okay. Those are applications absolutely where they'll pay for them. But in ubiquity, not so much. The place where we're seeing it, the real excitement here is talking about self-funded insured corporations. You take somebody like, I don't want to mention their name, but it's a large telecom that starts with an A, that has 200,000 retirees. And their current benefits, and this is public information, are roughly around $4.5 billion per year of those retirees and also all of the current employees as well. If you think about it, these are union workers that have been granted benefits from 15 and 20 years ago, and today they have to pay for them and under more costly expenditure. So organizations like that, it could be the A company, AT&T, it could be GM, Ford, it could be Verizon, Cargill, Pillsbury, the United Auto Workers or coal miners that are out there that are going under very big expenses. They're seeing their healthcare costs go up by 5 or 10% per year. With AT&T, that's $500 million a year. They're seeing increases. That's a huge direct cost to their bottom line. So they're looking at ways to make revenue under the healthcare space, but then when they looked internally and dog food it with their own employees, they can see about saving their own cost as well. So a lot of people are starting to look at the large corporations and trying to replicate this. One last thought is, with healthcare reform out there, I don't want to get political with it, but they mentioned earlier about the accountability care organizations, the ACOs. It's been really hard for us to get reimbursement out of CMS for these type of devices because of lack of ROI and efficacy and stuff. But you also think maybe there's a smarter notion here. Maybe the ACOs in the medical home are going to make that pay-per-performance aspect of it and pay that $11,000 to a family practice and say, you're now in charge of Kent. His oxygen saturation is too low, and you need to keep him up, and I'm going to pay you $11,000 a year. If you keep him out of the hospital by using technology like this and it costs you $5,000, then pocket the rest. That's fine. But if it costs you $20,000, you're eating the rest for it. So it makes them go through and be accountable, and that's what a big part of this is going to be.
Just switching gears away from the money side, one part of the discussion that really hasn't come up today is the regulatory side. And just real quick, whenever two industries are converging like this, wireless and healthcare, they each have to get to know each other's regulatory paradigms. So is the regulatory environment, particularly the FDA, is that a threat to this emerging wireless health opportunity? Don?
It's not necessarily a threat, but when it is perceived as a threat, it's more often a mystery. And so there are many, many devices that actually can be helpful for healthcare and consumer health that don't actually need FDA approval. Now, some companies actually decide to go ahead and get it because they think it's going to help in the marketing side of things. But there's a line between those that need it and those that don't. I'll give you an example here. This is a wireless pill bottle that knows when you've opened it, when you've closed it. It has reminders here. It communicates with this nice little wireless nightlight. Notice you just plug it in, little nightlight. This goes to the internet. It can communicate with your phone and say, time to take your pill. And it can also tell son or daughter that grandma's taking her pills on time. So very nice little system, non-FDA approved, available on Amazon. So that's one side of the equation. When we do get into the FDA side of the equation, a lot of the devices we're seeing are going to come under 510K, which is a relatively straightforward, relatively well understood process. The problem or challenges come when the devices have to come under a much more expensive process that requires a lot more testing and clinical trial work. And the fear is, at this point in time, with the feds, is that the FDA is seemingly tilting towards tightening up the process and requiring more to go under what's called a PMA process, which is a much more expensive, much more time-consuming process. What's the result of that? Is when companies look at the PMA process and say, this is going to take too long and cost too much money, then the next result is just leave the United States. Go launch your product somewhere else. So what was really happening right now is a lot of companies are saying, let's forget about the U.S. market to start. Let's go to India, let's go to China, let's go to Africa, let's go to, in some places, parts of Europe, and start there.
I think a big concern that I have is that you use this example here is separating the software from the hardware. That hasn't been dealt with completely yet, and I think that's the mystery you're referring to, is there's going to be a line there of, if it's just a software application running on a piece of hardware, what needs to be FDA approved, and how far is that going to go into the hardware side? Because that's where it could start causing problems if you've got an agnostic device, and just because it's running a healthcare application, does that actually require now that the device needs some sort of FDA approval? That's going to be a big problem.
Listen, I think that really, if you want to understand the FDA is about the relationship you have with the FDA. They don't give a hang what this looks like and how much it's going to cost and everything else with it. But what they do care about, it's a relationship you build of trust between the FDA and between the company itself. They want to make sure that your device is not causing any harm to the public, either in physical harm or getting information wrong as well. So the clear line when we see with this, ours are FDA cleared. We're working on a third FDA clearance right now. And the reason why we sought FDA clearance is because it depends on what you're going to do with that data as well. If that data is going to go into a repository where only the user sees it, and it's not going to be used in some type of clinical setting, then fine. It's wellness then. It doesn't have to have FDA. But if it's going to be uploaded now to go into Epic and MyChart and other places that are Optum Health or whatever, a next-gen, Allscripts, that a physician can see it and make a clinical decision, then it absolutely is FDA. And it falls under 60601. There are a lot of, I'll just comment on that really quickly. That's where the conundrum comes into this, and using a regular cell phone for this and a device that we created. Because we created this, we fall under 60601, so all of our chargers have to be to a higher standard than a cell phone does from an electrical standpoint. And they're getting cell phone applications.